Hi, a very good evening to all of you. Today we are going to discuss a particular case now, and the patient name is Anna Paro. Her age is 75 years, and you know that you are a nurse. You are a district nurse. That is the nurse caring the patient at her home, and you are taking care of the dressing, daily dressing of leg ulcer which she has. Mrs. Sparrow has leg ulcer, and you are doing daily dressing for her. This is what you can see there. So the condition is that we'll be seeing the condition later. First of all, let's go ahead with the writing task. You are writing a referral letter, so you are going to write a referral letter to Anna Paro, and this is the pharmacist of Anna Paro. So it's not Anna Paro, referral letter to Anna Paro, pharmacist. So the pharmacist who is caring Anna Paro, this is what to the pharmacist of Anna Paro, you are right. And we are asking the pharmacist to teach her about inhaler. So this is what we have to see here. We are writing to the pharmacist to teach her about the inhaler. So what exactly is happening? We will be seeing in the case notes. First of all, let us see in detail. I have assessed earlier that the picturizing thing, you are a person who is going to give daily dressings for ulcer for Mrs. Sparrow. So as far as you are writing to the pharmacist of Mrs. Sparrow, we have to be very careful when we write the medical history. So you can say a lot of medical history here. All this medical history, because the pharmacist of Mrs. Sparrow knows what exactly is the condition of Mrs. Sparrow, because the pharmacist knows what exactly is her condition is. So I don't need to specify that she has appendectomy, she has osteoarthritis, she has leg ulcer. Right now she's taking paracetamol, salbutamol or ipratropium. So all these things the pharmacist knows. So very perfect things, the pharmacist knows everything there. So but you know that the condition is to be highlighted. So the present condition is worsening COPD. So that is to be mentioned somewhere. So the name, age, and this thing, COPD, should be there. Now, what exactly is the social history? We don't need to mention because pharmacist knows again. Now let's go ahead and see what exactly is today's matter. Today, that's on 10th March 2018, patient Mrs. Sparrow has shortness of breath, and it is increasing, especially while doing day activities. And she has the subjective feeling that the salbutamol is ineffective, and she responds, she complains that salbutamol is not effective, and she tells you that she needs rest or sit down to hold breath back to settle. So if you have this shortness of breath, what you have to do is that the client tells that she needs to sit down and take rest. If you hold breath, So that would be okay. Now, let us consider the objective observations. Now we can see that the patient is comfortable at rest and not having any shortness of breath. You could see the respiratory rate is a little bit higher, but not that much. BP is normal. Auscultation, good air entry on both sides. And little V is on left side of the lung, so we can see that this is something which is notable. Observed patient's inhaler use. Now this is something crucial, that it is inappropriate. So you can see that patient is comfortable at rest. You auscultated and you can see there is no problem, but you can see small minor problem. That is the wheeze on the left lung. Now it can be the shortness of breath. At present, the complaint can be due to COPD, or it can be due to the inappropriate use of the inhaler. So what you have given is that right now it's something which is related to ABC, airway, breathing, and circulation. Now, airway, breathing, and circulation, ABC. So you have to give some, as a nurse, as a medical professional, you have to give some thing. Right now she has told that salbutamol was not effective. You advised her to have 2 puffs of Ventolin under supervision. So while on supervision, she was advised to take it, but you could see that it was inappropriate. So you just assess the way she was using the inhaler, and you have seen that it is inappropriate. So what exactly is the response of the nurse is that you be educating her regarding the proper use of this particular inhaler, and that was with spacer. But now she responded that this is not the way my pharmacist told. Absolutely no, this is absolutely something different from the way my pharmacist told me to do. So this is what the response is. So you are referring to the pharmacist to assess the condition and to give advice regarding the proper use of inhaler, because that he is responsible for doing that, because he has done that once, and now I think it is somewhere inappropriate. So it is the reason why I refer him back uh, the patient. So the patient's medical history and social history, the condition, the medicines that she is taking, everything is known by this particular pharmacist. So the date is 10, and that is today. You are writing to the pharmacist. Okay, dear pharmacist, you can say dear pharmacist. Yes. Or you can say dear sir or madam. As far as we don't have any name there. I'm writing to request further education to Mrs. Anaparo. Is it Mrs. Anaparo? Yes, it's Mrs. Anaparo. One of your clients who has been suffering with the worsening symptoms of chronic obstructive pulmonary disease. Okay, so I can say I'm writing to request further education to Mrs. Anaparo. A known case of yours. Okay, so this is a request. I'm writing request further education to Mrs. Anna Paro. Um, uh, uh, who a non-case of yours who has been suffering with the worsening symptoms of chronic obstructive pulmonary disease. See, I need to find a way to upgrade this particular purpose because the purpose should be a little bit more upgraded. So I would say I am writing to I'm writing to refer Mrs. Anna Paro, a non-case of yours, who requires further education regarding the use of inhaler. She has been suffering with the worsening symptoms of chronic obstructive pulmonary disease. That's it. Now, I just have made the purpose little bit shorter and little bit formal. So you can say it was the somewhat we had more number of words, and it was like some sort of explanation. So what we are going to do is that we are going to brief these things in the purpose paragraph. So the most brief thing, but you have to see the essence are there. The essence is there. You are writing a referral letter, it is there. The patient name, the full name, it's there, Mrs. Anna Paro. And what she requires further education regarding the inhaler use. So is it a non-case to you? Yes, it is your client. Very good. We have given a lot of data in just one sentence. Well, only thing that is that you okay. Uh, only thing what we have seen is that we have to use the proper use of punctuation there. Now we have the second sentence. She has been suffering with worsening symptoms of chronic obstructive pulmonary. You know, even though you know this thing, I have to mention because it's a non-case of yours, but right now, what's the condition? That's a diagnosis you have to say. So you have other past medical histories like leg ulcer, all these things, and you're not going to mention all these things. That right now you have to say that she has COPD and she has been using the inhaler in an inappropriate way, so that she is being referred to you for further education. The patient is known to you. Everything is mentioned in just 2 sentences. Now, if I go further, what exactly happened today? Today, while on home visit for Mrs. Paro's leg ulcer dressing. So why are you writing this letter? So what happened, when it happened, how it happened, where it happened? All these things should be there in when you are writing this letter. You are not just a district nurse, you just don't write district nurse at the end. You have to say today, the time frame, it's there. The time frame today is there. While on home visit. So while on home visit for Mrs. Paro's regular. So what happened? When did you observe? Today. The purpose of my visit was to give dressing for her leg ulcer. So at that time, while on that time, she complained of shortness of breath, especially during day activities. It was when I visited Mrs. Sparrow's home for her, giving her daily dressing for her leg ulcer. She complained me regarding the problem, and the problem was shortness of breath. And this happens during the day activities, she complains, and it is not there at night. She also complained that the issue is not resolved with the use of salbutamol, which was prescribed for her. Yes, we have to understand that salbutamol is something which was prescribed for her. And she reports that this particular issue, the shortness of breath, which she feels, is not resolved. She observes herself and she reports to you that the problem is not resolved with the use of salbutamol. So these two things are subjective data. So the patient says these things. And from this point, you are doing some observation. You observe, on observation, her condition was seen improved while at rest. No, okay, she has got improved, her condition improved at rest. However, while auscultating, a light wheeze was observed on her left leg. So I use the word observed almost twice, so I have to say on assessment. On assessment, her condition was seen improved while at rest. I don't need this while, improved at rest. However, while auscultating, a little wheeze was observed on her when auscultated. So one more correction is there. A little wheeze was observed on her left leg. So I have made the subjective and objective assessment, subjective report and the objective report. I'm telling the pharmacist, and this is what this is what she complained, and this is what I observed. Clear. So let's move on to the next area. So you assess the condition. After understanding Mrs. Parro's condition is worsened, either due to COPD or due to the improper use of inhaler. Now, we have the word COPD, the abbreviation of chronic obstructive pulmonary disease. You are writing to a medical professional, and you have already mentioned this thing, explain chronic obstructive pulmonary disease in the purpose. You don't worry, you can write the abbreviation here because you have already mentioned the full form there in the earlier, and you are not going to write this particular letter to a non-medical professional. You are writing this letter to a medical professional. So there is no problem in writing COPD. That is a universal abbreviation. We do have this universal abbreviation everywhere inside in the world, right? Now it can be either due to COPD, or it can be due to the improper use of inhaler. So I understood that this may be because of this thing or the other thing. Now she was advised to inhale 2 puffs of Ventolin under supervision. And it was then when she was found using it inappropriately. So it is one word there. So we have said when she was found using it inappropriately, when we understood that it may be because of COPD, it may be because of improper use of inhaler, We have given her 2 puffs of Ventolin, and we observed that it was, then we found that it was she was using it, the inhaler, inappropriately. So what was my response as a nurse is that even though she was given education regarding the use of inhaler with spacer, so I have given education for this particular lady. And however, she responded it was not the way she was taught by the pharmacist. So the pharmacist taught her in a different way. This is what she claims there. So this is the second situation. So what exactly happened after observing the condition of Mrs. Parrow is that we found that she might have problem with her condition COPD or improper use of inhaler. We advise her to have Ventolin in 2 puffs, but we found that the inhaler use was not up to the way, was inappropriate. Now, on response, we have educated her, but she told it's somewhat different from the way which the pharmacist has taught her. Now, it would be appreciated if you could assess Mrs. Parrow the way Mrs. Parrow uses the inhaler. So if you could assess the way Mrs. Parrow uses the inhaler, now this is what you have to do, and provide her re-education if necessary in order to improve her condition. Now, if you find something wrong in the way which she uses the inhaler, you please assess the way, and if necessary, you need to give a re-education in order to bring her back to normal. So that is to improve her condition. That is from she has to recover from the worsening symptoms of the COPD, that is shortness of breath and all these things. Now we have closed this letter. Yours faithfully, district nurse. Now I have to say, if you one more thing is that if you have any further queries regarding Mrs. Parrow, please do not hesitate to contact me. Yours faithfully, district nurse. Now, the letter is complete. We have enough words there. It's concise, it's well organized. We have all the relevant points there. We excluded some points which we don't need there. We have given a proper and concise purpose. We have got the explanation of the purpose in the body paragraph, 2 body paragraph, and you have given a clear task for the reader, that is the pharmacist, what exactly he has to do. So everything is clear, and that is the end of the explanation. Thank you.